The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
Tonight on Health Connections, insight on how to plan financially for long-term care and reasons for long-term care insurance. Stay tuned. As more and more baby boomers enter the phase of their lives acting as caretakers for their parents, they encounter many new obstacles along the way. One of those is long-term care and the issue of paying for the expensive care. With us tonight is Gerard Goulet, an expert and educator in the area of long-term care insurance. Gerard, thank you for joining us tonight.
Thank you for having me.
So Gerard, tell us what exactly is long-term care insurance?
Well, long-term care insurance is the primary way of paying for long-term care. Long-term care right now is very likely to occur, and then when it occurs, typically in our 80s, mid-80s, the cost is absolutely astronomical.
So how does it differ from standard medical insurance?
And a lot of people confuse the two. The difference in between long-term care and standard traditional medical care is the objective of long-term care is simply to help you maintain your level of functioning. The objective of medical care, traditional medical care, is to make you better. In most of the cases, when people need long-term care, they're really not going to get better. They have some chronic illness that is going to be progressively getting worse as they get older.
Okay. So as an educator, do you find that this is something that people know tons about, or is this a very unknown subject for most people?
It tends to be, people do not know a lot about it. I teach a number of classes in the topic, and the thing I find is there's a large misunderstanding about long-term care. People have impressions that were made several years ago that were probably true at the time, but are no longer true. There's a lot of other misconceptions about how much it costs, where it is delivered, and so forth. And I try to give the pros and cons, give all the details of those aspects.
Give us a little taste. What are some of those aspects that people have misconceptions?
Well, like everything else, long-term care insurance has pros, has cons. There's nothing out there that's perfect. When I talk to people, I say, you know, there are some things that are good. Those very same things that are good, when viewed from a different perspective, have some not so good things about it. Specifically with regard to the pros and cons of long-term care insurance, many people think that it's a lot more expensive than it actually is. They're usually surprised when they find out what the actual costs of the insurance are. One of the other things is they tend to associate long-term care with nursing homes. Now, most of us, realistically, will never go to a nursing home. And yet, 70% of us are going to need long-term care. It won't happen in a nursing home. It typically will happen in our own homes, in assisted living. Those are a lot nicer environments than the nursing home.
So you say most people are surprised by the low cost of the insurance. What about the cost of the actual care itself? What kind of differences do they see?
The cost of care is large now. Right now, an average cost in this area, and it really depends on the level of care, and it also depends on the geographic area. But right now in this general area, 1 year's worth of long-term care in a nursing home costs around $65,000 a year. It'll cost more if the people need more care. The issue with that, though, is that's today's cost. Most people do not need long-term care today. They're going to need it when they get to be 85 years old. And most of us are going to get there because we have all this wonderful medical technology in this area. So the thing that people really need to focus on is what will be the cost of care when they are 85 years old. One of the numbers I use, and it's a pretty realistic number, is 5 years worth of long-term care starting 20 years from now will cost over $952,000. People
For
are
5
often,
years.
For 5 years. And 5 years is not a heck of a lot of care in today's world. People are often, they know it's expensive, but when they hear those numbers surprise them because they haven't actually looked at some real numbers, and those are really big numbers.
Where do you get those, that kind of, is there somewhere that serves those numbers, or where do you get that estimate?
There's a lot of different estimates out there. The way I do that, the way I got that number is I look at the average cost of care in this area. That's $65,000. I make the assumption that that's the cost today. That cost is going to increase with time due to inflation. So if you assume that that $65,000 a year today is going to go up by 5% inflation cost each year, and you run the math on that, that will end up saying that 5 years worth of care 20 years from now will cost $952,000.
So at $952,000, see if I can do this in my head really fast, about $180,000 a year, plus a little. But so the cost of living today, I mean, for the average person, you look at your average economy for a family of 4 in the United States is $48,000-ish. Okay. And we've got long-term care expenses of $65,000 a year. Why is it so much more expensive for folks? And how is it that if we're to get into an insurance platform in this sense that it's going to actually pay for itself? How long would it have to be able to be in it to be able to get a benefit out of it?
Well, those are good questions. I mean, one of the reasons that it's so expensive is because it happens in a nursing home. Some of it happens in a nursing home. Nursing homes tend to be very, very, very expensive. Now, as I said earlier, most of us will not go to a nursing home. On the other hand, if we live long enough, if we live 85, 90, the chances of going to an actual nursing home are very, very high. Most of the time, people will start at home or assisted living. Those costs in today's world may be around $36,000 a year, not the $65,000 for a nursing home. And by the way, that $65,000 is a kind of a local cost, meaning southeastern Minnesota. It's significantly more expensive in the Twin Cities. It's significantly more expensive on the East Coast and the West Coast. The Midwest, where we are, is relatively moderate costs compared to the rest of the country.
So with this, are those costs spread across large groups, or are you looking at individual basis that is more of the impact?
From the insurance point of view, the way a good way to finance that cost is to transfer the risk. The risk, the probability of needing long-term care is really extremely high. 70% of us who get to the age of 65 will end up needing long-term care. When you go to long-term care insurance, what insurance is, it's transferring that risk. You pay something to the insurance company then pays for the long-term care of the people who need it. The reason it works is because not everybody will need the long-term care. So the insurance is actually a very mathematical thing. The cost of the insurance is based on the statistics of how likely is it to happen, when it happens, how long will it last, and what level will it be. Those are the kinds of things that go into the computation of the actual insurance premiums.
Okay. So you mentioned assisted living. Does long-term care insurance cover things beyond the nursing home, or is the only option, are you relegated to, you must go to a nursing home if you have the insurance?
No. One of the misconceptions about long-term care is people tend to associate it only with nursing homes. In the very early days of long-term care insurance, it did in fact cover only nursing homes. That was one of the reasons that people didn't want to get it. They didn't want to go to a nursing home. In today's world, the policies are a lot more comprehensive, they're a lot more flexible, and they cover home care, they cover assisted living, they cover adult daycare, they cover all of those things. The net result of that is having a long-term care insurance policy today is actually one of the things that'll help you keep out of a nursing home, because it'll pay for the things you mentioned. It'll pay for home care, it'll pay for assisted living.
So you can almost equate it to a preventative medicine type of situation.
Well, I don't know about preventive medicine, but you certainly can equate it to preventing having your assets go being depleted by the cost of long-term care. So what the long-term care insurance really does is it really prevents you from going bankrupt. Those costs are pretty high for the future costs. Long-term care insurance, in a sense, in a very real sense, can be looked at almost as retirement insurance. It really helps us keep our money, have our money last as long as we do, which is getting harder and harder to do because we're all living longer and longer.
So as an educator, and you teach a couple of different types of classes in this sense around long-term care, what are the real key components that people always come in and have that misconception beyond the nursing home aspect?
Well, one of the key misconceptions is they think it has to do only with old people. Right? Now, something like 43% of the people who need long-term care today are actually working age adults under the age of 65. Now, they don't need long-term care because they're old, because they're not. Those people often need it because of some accident, some illness. You know, Christopher Reeve, Michael J. Fox are examples of that. One of the other misconceptions is people have the impression that long-term care insurance is more expensive than it really is. Now, the reality of the situation is long-term care insurance is more expensive than other types of insurance. It's more expensive than your homeowner's insurance. But the reason for that is because of the potential benefit. You know, long-term care insurance can literally pay for that $900,000 worth of care. Because it has such a big potential benefit that will go to the consumer, then actuarially, the cost for that really needs to be able to support it.
You mentioned people think of this as, you know, for old folks type of thing. What age do you think people should be looking at insurance in this sense?
Well, I often get that question. You know, in the classes I teach, people will say, well, what's the best age to buy that insurance, you know? And they hear all sorts of different things about it. Here's my answer to that. If someone intends to buy long-term care insurance at some point in the future, maybe not now, but if they intend to buy it at some point, then mathematically and financially, the best time to buy it is always now, meaning at their current age, because that's when it's going to be the cheapest. So that's the best time to get it, is your current age, whatever that is. If it's 25, if it's 35, if it's 55, 65, whatever your current age is the best time because you're not getting any younger. Now, while that's the best time from a financial point of view, you also come up against the pragmatic reality of you have to pay for this. Long-term care insurance is paid for with discretionary funds. Many of the younger people do not have the kind of discretionary funds in order to buy it. So there's that trade-off between, well, I should buy it now, but I have all these other competing spending alternatives that may be more important. So they really need to balance those two items.
So what other, you've got the aspect of people need to realize that they're not getting younger or thinner, in my case. But are there other factors that come in that they should be looking at? I mean, if say, you mentioned Michael J. Fox, you know, something like Lou Gehrig's disease or muscular sclerosis or something that is prevalent in a family. Right. I mean, is that something that might be a trigger for them?
That's an absolute trigger. One of the things, many of the people who buy the insurance, they buy it because they've seen the devastating effects of long-term care and the cost of long-term care, maybe on a family member, a parent, a grandparent, who needed long-term care. One of the reasons why the best time to get it is now, especially when that now is for people in their 40s or 50s, is because those people are healthier. You know, how many of us know of people who get healthier as they get older? That tends not to happen. So people tend to put the decision off. As they put the decision off, their health changes, and they often get to the point where some medical event happens such that they are no longer even insurable.
So some of the other things happening now with healthcare reform across the nation, it's been just the topic of everyone across the board. Now, healthcare reform hasn't had a huge impact on this space, but there are many programs on the federal level that are existing now that nobody seems to know about. What are some of those aspects?
There are quite a number of federal programs. Traditionally, most of the long-term care in nursing homes has been and continues to be paid for by the Medicaid system. The Medicaid system does not have enough money in it to sustain it for the future. So what the federal government is doing is they're providing tax incentives for people to buy long-term care insurance. The federal government, the state government want people to take responsibility for their own care, so they're providing these tax incentives. On a federal basis, people can get a tax deduction on their federal income tax for long-term care insurance. On a state of Minnesota basis, and by the way, Minnesota tends to be a lot more progressive than a lot of the other states out there relative to its laws. Minnesota gives actually a state income tax credit for people who buy long-term care insurance, and some pretty recent legislation that not a lot of people have heard about in Minnesota is Minnesota now has available to its residents something called a partnership long-term care insurance policy. That's basically a policy whereby the state of Minnesota guarantees that the person who buys that policy can shelter or protect a really large amount of their estate assets. So a lot of things going on. The governments want us to buy this so that we don't have to go onto the welfare system. And they're providing incentives to do that.
So is there a balance there between Medicare, Medicaid, and the insurance amounts that you buy? I mean, should you be attempting to try and equal those out towards your costs, or just depend on one or the other?
Well, Medicare is a health care plan for people over the age of 65. Right? The objective of a health care plan is to make you better. So when people get to be over 65, they need care. If the care is going to make them better, Medicare covers that. You break an arm, Medicare will cover that. Most of the long-term care, though, is a situation where you're not going to get better. So Medicare covers almost zero, not quite zero, but such a small percentage of long-term care that it is now incumbent upon people to really get educated on how they're going to be able to provide the financial wherewithal to pay for their own care. They can do that by either having a lot of money, some people do, most people don't. The other and more cost-effective solution is to at least investigate long-term care insurance and transfer that risk to the insurance company.
So does long-term care insurance work the same way as medical insurance? I mean, it's what most people are familiar with. So do they have the aspect of a deductible they have to pay first that they have to plan for, and then a yearly cap that they have to plan for, et cetera?
Yes, it's similar, but quite a bit different, and it's quite a bit more complicated. It's complicated because it's also a relatively new product. People are a lot more familiar with healthcare, with life insurance, than they are with long-term care insurance. But yes, it does have a deductible. The deductible is how many days that you're going to have to pay for long-term care out of your own pocket before the insurance kicks in. And that deductible is a choice that you make. Okay. Another thing that's really important about this is the insurance companies limit their risks in two very important ways. And a lot of people don't understand exactly how that works. The insurance company limits their risk for long-term care insurance by, number one, the daily or the monthly amount that they're going to pay to someone when they need care. The other way they limit their risk is the total amount of money that they're going to pay. Right? The key thing that people need to look at to get a cost-effective policy, and by cost-effective I simply mean, for whatever premium dollars people want to spend, they're really getting the most bang for their buck. The way to do that is to concentrate on the daily or monthly amount that the insurance is going to pay, not to concentrate on the total benefit period.
Okay.
And I help people come up with how to design a policy that's the most cost effective for their particular family situation.
So with the deductible that you mentioned, where you're talking about a minimum days of long-term care, is there an aspect of short-term care there as well, where if say they have a hip surgery and they go to a long-term care facility, but for only 30 days, is there an aspect there?
It is, and that's an important aspect. When Congress formed tax-qualified long-term care insurance, they actually defined what the long in long-term care means. And the definition is that people are needing, in order to get benefits from the insurance company, there needs to be the expectation that the care will last at least 90 days. It is not for short-term care. It's really to handle the major catastrophic costs that come across when you need that long-term care. So yes, that's an important thing. It doesn't not cover the very short-term kinds of things.
Okay. So when you're working through costs with someone and you're trying to determine what the best plan for them is, it seems like there might be some inverse oddities when it comes to try and plan for people. If they're overweight and of poor health, they might actually have less time in a long-term care facility based on the likelihood of long life, etc. I mean, do you find that that's true, or is it that people that are healthy have to plan for longer insurance period, and people who aren't plan for shorter, or is that not the case?
No, it's definitely the case. One of the factors in the cost of long-term care insurance is your health at the time you buy the insurance. For those people who are in poor health, those people get a health rating such that it costs more for them to buy the insurance, which is all logical. It's all very mathematical. They have a much greater chance of using it. For people who are in excellent health when they buy the insurance, the premiums are less. Okay, so that's another reason why people should look at this, when they're young, before they get some health conditions that will preclude them from buying the insurance in the first place. So yes, their health makes a big difference in terms of the cost of the insurance and the likelihood of needing it.
Okay. So if you were to boil down long-term care insurance down to a couple of simple things that people must know, what are the key things that you think people should know before they get to the point of saying, I need to know more, and go and find an educator like yourself?
One of the key things that they need to look at, in fact, two of the key things are these. Number one, they need to understand just how likely this is to happen. Many people are kind of in denial. They say, well, I don't have to worry about this stuff because it's not going to happen to me. It's actually very, very likely that it will happen to each of us simply because, and particularly in this area where we have all this wonderful medical technology, it is literally a lot harder to die than it ever has been. That itself has pros and cons, okay? For some people that'll be good, for some other people it won't be so good. So they need to do that. They need to look at the likelihood of needing it. Then the second thing is they need to look at what will be the cost when they need it. The important thing about that is that's not a today cost, because people who get it today, you don't need it today, right? They're going to need it when they get to be their mid-80s. That's when my mother needed it. My own mother ended up spending hundreds of thousands of dollars on long-term care. So the two key things that people need to look at are the future costs and the likelihood that it's going to occur. Once they get their hands around that, then long-term care insurance is one of the few things that can help provide them with, in essence, having their money last as long as they do.
Okay. So what other resources, once people reach that point, there's individuals like yourself who are long-term care educators. Are there other resources that people should be looking at to go out and investigate?
There's a lot of resources. In today's world, as you know, the internet provides us with an infinite amount of resources, okay? You can look at all this stuff on the internet, and that's fine, but it takes a lot of time to do that. The thing that people really need to look at with this is they need to go to someone who understands the details. Many people understand the broad brush, the high level things, and that's fine. But the devil is in the details. So that being the case, I think it's important for people to get educated correctly. There's a lot of misinformation out there based on past impressions. So they need to get educated. They can do that by going to someone who specializes in long-term care insurance. I've been specializing in it now for about 12 years. It's the only thing I do. I primarily do the education, but I can also help them get the product if they want to.
Okay. Well, Gerard, thank you very much for coming on the show tonight, and I think it's great to be able to take something that people aren't really familiar with and be able to expand it out for them. So I hope some folks come and see your course and can get educated. So
thank you.
So again, this is Sean Riley with Health Connections, and we'll see you next week. Thank you.